Great news in women's health. If you happen to be someone that doesn't want to have the speculum exam for the cervical screening test, or what we used to call the Pap smear, your 30 years are over. It's been 4 years or more since the last screening test, or in some cases have never had it, and you don't have symptoms. So nothing concerning spotting, bleeding, anything that makes us think that there should be a worry or concern there. Your option is available for a home or self swab. So I've ordered them in here at Living Well because I don't want the collection procedure to be prohibitive for someone to get tested. So this is all about avoiding cervical cancer. And the cervix is where the womb or the uterus meets the vagina. And if someone has something called the HPV or human papillomavirus, a lot of people know it can be related to getting genital warts, but people don't necessarily get the warts, but can still have the virus. The virus irritates the cells in that area, so they have to keep replicating, and the more we have to do that in a pressured way, the more likely we make mistakes, and those mistakes can add up to cancer. So typically, we use a speculum to have a look, make sure the cervix looks normal, and take a sample and send it off and see if the virus is there. It's changed from the way the Pap smear used to be. Now, if someone has that virus, we watch them closer because they're more at risk. If someone doesn't have the virus and doesn't have symptoms, then they're tested every 5 years to check for that. So for people at low risk, less tests, and the people at a higher risk, monitored more closely because we don't want you to get cervical cancer. Really simple. You come in and see your GP. We show you and give you the swab, which is just a wee little swab, if you can have a look there, much smaller than your average tampon. Hand out to see how easy it is to do it for yourself, and giving you a form, and it's put in the mail to a special lab in Victoria, and then we get an answer. So if you've been putting off that Pap smear or cervical screen because you are worried about the examination that goes along with it, have a chat with your doctor. We can make it as comfortable as possible, but if it's not for you, I don't want this to hold you back. Come in, let's get this test, let's keep you healthy, let's avoid cancer, keep you out of hospitals. Any questions, let me know. All right, it's available.